This is your Danish English Special Report on healthcare, sterilization, and GP access. Welcome to Danish-InfoNews TV Special Health Report. In today's report, we bring you in-depth coverage of two major stories shaping healthcare in Denmark: access to your GP and the rise of male sterilization. Now welcome to this Health Magazine Special Report. Fairness and responsibility in Danish healthcare, from GP fees to vasectomies. Denmark's healthcare model is known worldwide for its strong focus on equality and accessibility. But even here, questions are being raised about fairness, money, and responsibility. Right now, two major debates are shaping the conversation. Should patients be able to buy faster access to their GP? And why more men than ever choosing sterilization as a form of birth control? Though these stories seem very different, though they touch the same values, equal access and shared responsibility. 750 krona for a doctor's visit. In June of 2025, the company Lægerne Denmark made headlines by offering same-day GP consultations for 750 krona. The model is simple. If you can pay, you get an appointment right away, even during the same hours when doctors are normally seeing public patients. Through Denmark's universal healthcare system. This sparked alarm among politicians, unions, and healthcare officials. The biggest problem is that not all citizens can afford it, and therefore they can't get the urgent appointment, said Annette Blynel, Regional Council member in southern Denmark. Critics argue the practice creates health inequality, undermining the principle of free and equal access to care. The company, however, insists there is no problem. Co-owner and GP Jacob Friis Espersen explains that doctors simply reschedule administrative work for later in the day, freeing time for private patients. It doesn't affect public patients. We just move some tasks to the afternoon. And it's nothing new. People in Denmark have paid for private hospitals and specialists for decades, he argues. Still, skepticism remains. Some regional leaders describe it as a problematic mix of public and private practice. The case will now be reviewed by the National Cooperation Committee, which includes Danish regions and the Organization of General Practitioners, PLO. A ruling is expected later this year. Men and responsibility, vasectomy on the rise. While doctors and politicians clash over money, another trend is reshaping family life in Denmark. Men are increasingly choosing vasectomy. In 2023, over 4,000 Danish men underwent sterilization, double the number compared to a decade earlier. Most were between 35 and 39 years old. Journalist Rasmus Tirupbæk is one of them. In 2021, after he and his wife had the two children they wanted, he decided to step up. She had been on birth control for years, even before we met. For me, it was a much simpler procedure. I thought it was only fair that I took my turn. Doctors say the procedure is safe, quick, and far less invasive than female sterilization. Most men only experience mild soreness for a few days. Experts point to two main reasons for this increase: growing awareness of the side effects of hormonal contraception for women, a cultural shift toward greater equality in family planning. Many men have already had the family they want. They don't see a reason for their partners to continue taking hormones. Explains Jeppe Held from Sex and Samfund, a national organization for sexual health and education. Sterilization in Denmark, what you need to know. Sterilization is a highly relevant topic for many Danes, and here's how it works in practice. Public healthcare. Sterilization is free in the public system if you are above 25. Those aged 18 to 25 can also apply, but must undergo a 6-month waiting period, unless there are special circumstances, such as genetic illness. Private clinics. Some people prefer to pay for the procedure privately, often to avoid waiting lists or to choose their doctor. Prices typically range from 6,000 to 10,000 Danish krona for men. Insurance support. Members of Sygesikring Denmark can often get part of the cost covered when using a private clinic. Let's look at the process. It always begins with your own GP, who provides counseling and ensures you understand the consequences. Sterilization is considered permanent. Reversal is possible but complicated, expensive, and not guaranteed to restore fertility. The common thread: fairness in healthcare. At first glance, the two debates, GP fees and vasectomy, seems unrelated. But look closer and a common theme emerges: fairness. On one side, health authorities insist that access to your doctor should never depend on the size of your wallet. On the other, more men are stepping up to share the responsibility of contraception instead of leaving the burden on women. Both stories reflect the same value. Healthcare in Denmark is about equal access and shared responsibility. So, looking ahead, the coming month will show whether Lejana Denmark's business model survived legal scrutiny, or whether it's shut down as a violation of Denmark's healthcare agreements. At the same time, vasectomy numbers are likely to keep rising as cultural norms shift and men increasingly view it as their own turn to take responsibility. In both cases, the debate isn't just about medicine, it's about how we share responsibility, costs, and rights in a modern healthcare system. That's it for today's Health Magazine Special Report, a closer look at fairness in healthcare, from the doctor's office to the family home. You've been watching Danish-InfoNews TV, and this has been a special health report. If you found this coverage valuable, don't forget to like, share, and subscribe so you never miss our in-depth reporting on Danish health and society.